Yeah, hello everyone. I'm Gulshan. Used to work as a GP in Lichfield in Staffordshire, and also clinical lead for the Frailty Project and the Staying Well pathway across Staffordshire. I'm here firstly to introduce a couple of colleagues. Dr. Rashi Negi is a psychiatrist. Dr. Krishnan is also a psychiatrist. And we're here really to tell you a bit more about an exciting new initiative that we're hoping to launch very soon. It's something that we felt collectively that was needed in the community, particularly in care homes, where we felt that there was a gap. We needed to support our care home colleagues, particularly the care home assistants, nursing assistants, to really try and identify delirium at an early stage and perhaps introduce some early interventions that would make a difference to these residents who are obviously at a higher risk of delirium. They're usually older, they're frail, they have multiple comorbidities and risk factors, and frankly, until hopefully until now, there wasn't a tool that people could take with them. And what we felt would be really useful is to take technology and put it in the hands of people. And we came up collectively with an idea to launch a Delirium app, which my colleagues will speak about a bit more. But hopefully this helps care homes to identify delirium at an early stage and prevent unnecessary hospital transfers and ED admissions. Obviously, we'll talk a bit more about how it all works and how this hopefully should improve the quality of care in our care homes. And also help GPs to manage this very common condition a bit better than we have in the past. So on that note, I'm going to hand you over to Dr. Rashi Negi to tell us a bit more. Rashi?
Thank you, Gulshan. I'm Dr. Rashi Negi. I'm consultant old age psychiatrist. I work very closely, like Gulshan, very closely with care homes and their staff. And like Gulshan was saying, that we were thinking about, if you like, sort of making the journey of the patient leaner, because often we have felt that these patients who were suffering with delirium do end up in hospitals. And from there, of course, their journey at all kind of changes really, because the more chances of being undiagnosed with delirium and you are sort of, in a hospital setting, the less likely you actually are going to return either back to your own home or, sort of care home with a higher level of needs. So this has been a quite common condition owned by all of us, all professionals. And what we felt that perhaps this would be an opportunity to support, help and empower the care home assistant to manage this common condition with the help of technology, as Gulshan was saying, with an app, as opposed to something having in the leaflet or something, a chart in the office, because this is an interactive tool where they can actually work with the patient using this tool and hopefully manage the common condition that are often the cause of delirium. I will hand you over to now Dr. Krishnan, who is going to explain a little bit about the Delirium Wheel. That's the title of our app. That would, and probably we will, at the end of our conversation, we would see a demo of our app to see how it works. So over to you, Krish.
Thank you, Rashi, and thank you, Gulshan. It is absolutely exciting to launch this app quite aptly on the week ahead of the World Delirium Awareness Day. So we've been working tirelessly in the last couple of months to get this ready for the WDAD 2021. And I'm very excited to have collaborated with Gulshan and Rashi in this project. Again, delirium has been one of my passions for a long time. And especially as Rashi and Gulshan mentioned, delirium is everybody's business. When you think of delirium in the community, which is commonly underdetected and also underdiagnosed, it is only fair that we are able to give the staff in the shop floor who can very quickly detect delirium, and also simple non-pharmacological management that could actually prevent somebody from deteriorating from delirium is very important. So we have worked together to give some key pointers in preventing delirium as well as detecting delirium and signposting to appropriate support. So we will probably demonstrate how the app works briefly. And then do you want me to give a quick demo, Rashi and Gulshan?
Yeah, that
I
would be
think that'll
great.
be great,
Yeah,
Krish.
right.
Yeah, go for it. Go for
Yeah.
it. Yeah.
I'm going to share my screen, and this is how the wheel appears. This is called Delirium Wheel. You will know why it is called Delirium Wheel in a minute. So as soon as you click the Delirium Wheel, you get the I Can Prevent Delirium logo, and then it gives a welcome to app and ask them, are they different today? And then it gives you various options of, if there are physical changes, it tells you how to signpost red and amber. And then there are information available for you to escalate, like a deteriorating patient escalation pathway. And if they have a behavioral change, it also gives you a signpost of a hyperactive and a hypoactive delirium. And then if you continue that, this is the wheel as we talk about. So you may be able to click on the segments of the wheel to get what are the things you may be able to do with regard to non-pharmacological management. So this is like a quick ready reckoner of what they could do, what they could do within their team, or what they can do with the help of support from the team. And once they have gone through the checklist of the delirium wheel, you will be able to get like a summary of your strategies. And, you know, again, it just goes through systematically. And then the summary can be emailed to the team email so that, you know, they can put it on patient's case notes if needed. So this is really useful. And then we also have collated some resources, you know, and then you may be able to look at all the resources. And if you click on like a 4AT, thanks to our colleague Alistair, who has given permission for us to use his website, you can actually do the 4AT from this app. And we've also provided various resources, including our own Northeast resource with regard to delirium prevention. And we have even developed some videos. And there are some videos of delirium superimposed dementia. So all those information is available for you to use. So hope this helps. And I'm just going to hand over to Rashi and Gulshan if there are anything you want to add on.
I think I just wanted to sort of, you know, thank this is a stage that why this dream has kind of, you know, we made it, you know, obviously it was a dream to have an app initially, because when we started with the frailty collaborative initiative, it wasn't something that came about, you know, at first we were not sure even delirium pathway would be included in this big initiative. So somehow that has happened thanks to Dr. Kaul, and, you know, because he works very closely with the care homes, and he understood the importance of this delirium being the main sort of if you like, main or like one of the main issues when it comes to caring for older people in care homes and preventing these unwarranted admissions. And I think his journey kind of really started from there onwards, really, when we were awarded some money to develop the delirium pathway. And as part of the delirium pathway, we decided to spend the money on developing this app. Over to you, Dr. Kaul, if you want to add something in what we just...
Yeah, thanks. No, thanks, Rashi. And absolutely, just to build on that, I think I'm just super thrilled really to introduce this app, and I hope you know, it's well received. What we've tried to really do here is give the people closest to these vulnerable residents a tool that they can use, they can carry with them everywhere, easy access, easy reference, and really something that comes to mind is it's so distressing, isn't it, when our frail and older people are sort of transferred to EDs and to wards that they get so distressed. And hopefully this will help people to manage people closer in their familiar environments and closer to home. And something that I'm reminded of is a very brief kind of statement, but I think it's very apt. It's people we know looking after people we know. So on that note, I'll hand you over back to Krish just to summarize and.
Yeah, thank you so much, Gulshan. I think, again, as all of us, we all at some point in our career thought about, could we do a medical app that will help our patients and staff? And I have tried and failed a few times to develop, but thanks to the collaboration, that even all our dreams have come true. It's like Christmas has come early, and we are excited, even though we are not a big techie savvy people, but thanks to our IT team from Leicester Partnership, who have helped us to develop this, and they have worked very closely with us to develop the app. And there may be few teething issues, and it will be great if people can give us a feedback. We will try to get some way of getting feedback, so that probably the version 2, we will have more information and we will be adding more resources. But please use it. It's free. It's available on both App Store and Android platform. So use it. And in this journey, we're all together. I just want to highlight Delirium is everybody's business. And let's make sure that we provide right care to the right people at the right place, and avoiding unnecessary admission, also preventing delirium. And thank you all for the attention. Thank you.
Thank you. Thank you, Krish. Thank you,
Krish.
Rashi. Let's make a difference today.
Let's make a difference together.
Thank you.
Thank you.